Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here helping companies look at their employee health improvement programs, as well as work with Nick and others on COVID and the return. So this week, Nick, interesting report last week on September 3rd out of the CDC, their MMWR, talked about the outbreak associated with SARS-CoV-2 Delta variant in an elementary school in Marin County, California. We had a request by Andy, one of our colleagues, to take a look at this. And obviously, if you ever have a request and would like us to look into something, please reach out to us and we'd be happy to do that. Anyhow, let's get to this report, Nick, and then I'd love your comments on this. So this was a Marin County elementary school in a district with 30,000 students. It had been fully opened last year, obviously following certain requirements. And up until the point of this study, there had only been 12 total school-wide infections since August of 2020. This actually occurred at the end of the school year, and Delta was just coming out. We didn't know a lot about it. And it turned out that there was an unvaccinated person, a teacher, who turned out to be the adult index case, who was not wearing a mask a few times, and during a 2-day period had symptoms, but had come into the school and had apparently been at some events 3 days prior to this. He was one of only 2 of the school's teachers who were unvaccinated, and subsequent to this index exposure, 12 of the 24 kids in one classroom were infected. All of the infected students were under 12 and obviously unable to get vaccinated. And in looking at the original classroom, Nick, I was thinking about this, and it's really similar to the earlier reports we had seen from the Chinese restaurant that we brought up months and months. I think it was sometime last year, actually. So throughout this period, all desks were separated by 6 feet. Good stuff. The students were seated in 5 rows, and interestingly, again, the attack rate in the 2 rows seated closest to the teacher's desk was the highest at 80%, while 28, or 4 of the 14 in the 3 back rows, got infected. In the end, 27 total cases, including siblings and parents. Some of these were associated with a sleepover, etc. There were also 4 parents that were infected. 3 of the 5 adults were fully vaccinated. They all experienced some symptoms, no hospitalizations. And it was sequenced, which was great. They followed that sequence. They determined it was all Delta. 11 were identical, including 6 from the original classroom. So again, we've got this outbreak indoors, unmasked, partially, unvaccinated teacher. What's it mean, Nick? What do we get out of this thing?
First of all, thanks to Andy for asking. I think great topic to discover and dive into. The first thing I would say is it's easy to pass judgment. And, I think people's reaction, depending on what side of the fence you come from, is maybe pejorative to the teacher because he pulled his mask down, he wasn't as compliant. And the first thing I would say is we have to take a lesson from the airlines where it's a no-fault root cause discovery. We would not have this detailed amount of data if there was a witch hunt for people that reported. And it's easy to say, well, he pulled his mask down and he's unvaccinated. We know nothing about that individual as to whether he can have a vaccine, so he may not be eligible. And when it comes to the masking, it's easy to say, you should just always wear it. Well, I challenge anybody to walk around anywhere at any time in the public and not see people doing this whole thing. I even do it. It's very difficult to wear these masks. And, this is an individual who's teaching younger age kids, trying to communicate. I pass no judgment on this. The other thing was he was symptomatic, and you can say, well, he shouldn't have come in. And again, I take the positive view of this and say, if he's like me, he may have had a nasal drip, a cough, didn't understand or did not comprehend the fact that he was infected. He clearly did at some point and notified the authorities. So in my view, this is not about the teacher. This is about what we can learn. And as you rightly detail, the critical points here. One, an unvaccinated individual was the index case that spread to this class. So vaccination is our primary cause or methodology for defense. Masking does work, but it has to be well followed and, this pulling things down. And you see it all the time. I mean, I have trouble hearing people. I see it on the airlines, somebody's leaning over to get their drinks order and they can't hear and they pull them out. It's just a natural human habit. This is not a witch hunt on individuals. It's all about informing and helping people get to the right decision making. And then the other thing I would say that's interesting, and you rightly point out, we went into the detail of that restaurant, but it was also the South Korean restaurant where we saw that distance of transmission. And whilst the transmission was lower in the back rows, it still occurred. And this is with the Delta variant, which we see is far more transmissible. So, what do we get from this? Well, first of all, we have to be testing. I think the most important thing here that I get out of this is we know vaccines work. We know that masks are absolutely preventative, but they have to be worn by both parties. Even, for folks that don't want to, we have to essentially protect our community. And then we need to be testing as frequently as necessary to be able to determine where these breaks and these infections come from. So I'm just delighted. I love science. I love data. It gives us more information. The sad thing is, it feels like it's a little bit of a repeat on information that we already got from the restaurant case study, and also the call center, I think, as well.
Right, absolutely. It really does point to the importance of doing these things. And I would also point out they were using HEPA filters in the rooms, and they did have the doors open. So there were efforts clearly to try and control this, which they ultimately were able to do. And they also point out that any spread beyond the school was probably limited because the county has a very high vaccination rate. So you didn't see this thing just explode out into the community like we've seen in other cases with some rapid growth in infections.
And the other thing that they did, which was, in addition, they did the phylogenetic sequencing to track it back. They didn't get the teacher's original sample to confirm it, but essentially the similarity of the genetics allowed them to link all of these cases together. There was this one other separate class, couldn't determine it. And your point is exactly right. They were doing all the right things. They had separation. These groups got it. And they got it in potentially outdoors. They were separated. They had all of these factors in play. And then you had this transmission out into the community, which, is part of what we're trying to prevent. So we have to follow the guidelines. Vaccination is the key. But the other thing that we need to be doing at this point is we've got to be wearing face coverings on both sides of that equation.
Indoors, absolutely. Well, thanks so much for diving deeply into this, Nick. Really appreciate it. And thank you, Andy, for submitting the question. If anyone else would like to, you can get us either via Twitter or LinkedIn or send us an email. Happy to take a look at it and report on it. This is Fred Goldstein with Accountable Health. If you'd like more information, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.